Hello, welcome, and thank you for joining Data 2020 Opportunities for All. Northeast Delta Human Services Authority is led by Dr. Montez A. Sizer, Executive Director. Collectively, we are all directed by our vision, mission, and tenets. Our vision, to build a unified Northeast Louisiana where individuals are thriving and reaching their full human potential. Our mission, to serve as a catalyst for individuals with mental health, developmental disabilities, and addictive disorders. And our tenets that guide our actions: greater access to services, excellent customer service, quality, competent care. Again, welcome to Data 2020, Opportunities for All, with Dr. Jeannie McGee.
Thank you, Maja. Thank you, everyone, for joining us this morning. I'm Dr. Jeannie McGee, Director of Behavioral and Primary Health Analytics at Northeast Delta Human Services Authority in Monroe, Louisiana. I joined Northeast Delta in January of 2019, and I'm very proud to be part of such a wonderful agency. I have a bachelor's degree in psychology, a master's in health sciences, and a doctorate degree in health education and research. I have over 20 years experience in clinical research and patient outcomes, and around 17 years in biostatistics as both a director and as a medical educator. Northeast Delta is a progressive agency, continuing to strive for excellence through innovation. The addition of the analytics department is a testament to Dr. Sizer's vision for the agency and for the people of Northeast Louisiana. Today's webinar is the final of the 2020 calendar year webinars. The goal of today's webinar is to provide information and final data results for the agency's fiscal year 20 service period, including provided services and ongoing programs completed for our clients here in Region 8. In line with the Louisiana Department of Health and the Office of Behavioral Health state reporting schedule, fiscal year 20 began July 1st, 2019, and it ended June 30th, 2020. Northeast Delta completes annual internal data reviews and analysis so that we can provide summaries of provided services, program administration, and client participation, and also overall demographic data of clients served throughout the year. Today's webinar objectives are to learn about the clients we served during fiscal year 20, summarize agency program implementation and participation, and to review the special initiatives undertaken and completed by Northeast Delta in fiscal year 20. First, I want to tell you a little bit about who we are and what we do here at Northeast Delta. Northeast Delta serves clients throughout 12 parishes in Northeast Louisiana, which make up Region 8 of our state. Our client population includes individuals with mental and behavioral disorders, addiction and substance use disorders, and developmental disabilities. Our services and programs were developed to address the specific needs of our client population and the unique issues that they face. By taking all of these things into consideration, we use a holistic approach in every possible way by providing not only mental and behavioral health services and treatment at our 6 outpatient clinics across this region, but by also offering several other things to our clients. Through our integrated healthcare services, we also screen and address basic primary health issues. We maintain a very active community presence through our prevention and wellness department. And we also have peer support and case managers available to all of our clients. We also have long-running collaborative relationships with several organizations and health facilities, and have developed a strong network of partnerships throughout the region. What really sets us apart is our focus on social determinants of health. Social determinants of health are all of those things that are specific and unique to people that influence their health, their wellness, but are most often not even addressed or even assessed when seeking treatment or services from most health agencies and facilities. These include things like a person's living situation and environment, their social economic status, employment, education, support system at home, and even things like transportation and how this might affect their access to health care. You may have heard these referred to as health and social disparities. These are the foundation of program development and our underlying philosophy of integrated healthcare at Northeast Delta, because we understand that treatments won't be effective no matter how good they are if the basic needs of people are not being met and aren't considered in treatment planning. We'll start the fiscal year 20 data review with a look at our outpatient clinics. Northeast Delta operates 6 outpatient clinics across Northeast Louisiana, which includes clinics in Monroe, Bastrop, Columbia, Ruston, Tallulah, and Winsboro. Our outpatient clinics provide both billable and non-billable services. Billable service are those that meet certain required criteria to be billed to client guarantors and insurance, including things like individual and group counseling. Non-billable services are services provided to our clients that do not meet criteria for submission to insurance companies or other guarantors for reimbursement, but we feel they're clinically necessary or beneficial to the client. And because Northeast Delta doesn't refuse services to anyone in need, regardless of their ability to pay, we typically have a large amount of provided services each year that are non-billable. For fiscal year 20, the total unduplicated client count having billable service was 1,809, with 1,680 clients completing our annual demographic data for analysis. It means that right around 93% of clients with billable services completed a client demographic form at least one time during this reporting year. Around 11,000 billable services were provided and 2,300 non-billable services were provided, for a total of 13,374 services provided in fiscal year 20. Since fiscal year 20 includes the COVID-19 pandemic months of March through June, the annual services number is really commendable, and it speaks volumes to the dedication and hard work of our clinical staff. As you can see in the next few slides, the most billable visits in fiscal year 20 were provided at our Monroe Clinic, and the most non-billable services were provided by clinical staff at our Columbia Clinic. The overall average number of services provided to each client in fiscal year 20 was around 7 services each, which includes billable and non-billable. The Monroe Outpatient Clinic saw the most clients having billable services, followed by our Ruston Clinic and then Columbia Clinic. Around 68% of our billable client sample had services paid through Medicaid. About 19% had services paid through Medicare in fiscal year 20. And around 5.5% were classified as OBH indigent. Over 72% of clients in our billable client sample who were seen at the Monroe Clinic received services billable through Medicaid, the highest percentage of all 6 clinics. The Ruston Clinic saw the lowest percentage of clients receiving services billable through Medicaid at 56.2%, which is still relatively high. A little over 52% of our outpatient clients were female. Clients were predominantly female in every age group except for the 18 to 25 years age group, where male clients accounted for 55% of the client demographic sample. As you can see on this graph, the majority of clients completing an annual demographic form were between the ages of 36 and 50. This was true for clients in both our billable and non-billable client samples, and client age distribution was pretty similar in both the billable client and non-billable client groups. Clients seeking treatments and services for a variety of behavioral and mental health disorders were seen in our outpatient clinics during fiscal year 20. Around 38.5% were diagnosed with some form of depressive disorder. About 27% were diagnosed with a schizophrenia spectrum or psychotic disorder, and almost 14% received services or treatment for bipolar disorders, and 8.2% were diagnosed with substance use or abuse disorders. Northeast Delta's network of partnerships includes inpatient addiction facilities where clients can be admitted for detox and inpatient addiction treatment services too. Let's take a look at the clients served through these partnerships this year. In fiscal year 20, there were 2,666 admits to our inpatient facility network. Now, this isn't an unduplicated client count, and some of these admits may have been clients who were admitted more than once during the year. But these numbers do show the value of the inpatient services that we help bring to Northeast Louisiana, and it shows the need for continued support of these inpatient facilities in our region. A couple of other crucial programs maintained by Northeast Delta are our gambling addiction and tobacco cessation programs. During fiscal year 20, 37 clients received gambling addiction services, which included 12 clients carried over from the previous year, and then 25 new client referrals. Clients are referred to our gambling addiction program from a variety of sources. For fiscal year 20, the majority of our gambling addiction incoming referrals came from the Louisiana Department of Corrections, followed by 16% from CORE, which is the Center of Recovery that's located in Shreveport, and 12% each from Rayville Recovery, which is one of our inpatient addiction facilities, and the Gambling Hotline. Our gambling addiction program also provides outgoing referrals to other needed services for our clients in the gambling addiction program, including AA, NA, and GA, as well as smoking cessation and other agency services our clients may need. In fiscal year 20, 40 client cases were closed. 55% of these were closed because the client met the goals established in the gambling addiction program. We'll now look at our tobacco cessation program. In fiscal year 20, 176 clients were served through this program. The majority of the clients were aged 26 to 35, and gender was just about evenly distributed, with just 4 more females than males. Over 58% of client referrals to the tobacco cessation program came out of our Monroe Behavioral Health Clinic. Across the 176 clients in the smoking cessation program, 547 related services were provided in fiscal year 20. Due to COVID-19, the majority of the services were provided through telehealth with phone calls and emails. Telehealth visits accounted for 81% of smoking cessation program visits in fiscal year 20. Smoking cessation services provided in fiscal year 20 included both counseling and nicotine replacement therapy. Around 63% of our clients received counseling alone, and nearly 37% received both counseling and nicotine replacement therapy. In addition to the services provided through outpatient clinics and our network of inpatient facilities, Northeast Delta also finances and maintains many social support and employment assistance programs to assist our clients with some of the social determinants of health affecting their ongoing health and quality of life. Next, we're going to take a look at some of these programs and services and how our clients benefited from them during fiscal year 20. Among the programs developed and maintained by Northeast Delta is the Louisiana Reentry Program, LRE, which is a partnership with Goodwill Industries of Northeast Louisiana for ex-offenders. This reentry program was designed to address the socioeconomic issues that increase recidivism among the formerly incarcerated in efforts to keep these individuals from being reincarcerated. Since its inception in September of 2018, there have been 57 clients who've been referred to the LRE Community Reentry Program, with 14 new enrollments during fiscal year 20. To date, Only one LRE program participant has returned to prison prior to the last follow-up at 90 days. Another program developed and supported by Northeast Delta is the SOS program. SOS stands for Second Opportunity Workforce Solutions. This program addresses access to employment and provides supportive employment services such as job readiness skills to our clients. Employment access is another social determinant of health identified by Northeast Delta as critical in our clients' ongoing health, quality of life, and ability to thrive in society. Since it began as a pilot program during the fourth quarter of fiscal year 17, 229 clients have been referred to SOS, with 110 clients being admitted to the workforce program. And finally, our Partners in Employment program, which we refer to as PIPE, is a program aimed at improving employment outcomes for our clients with developmental disabilities by developing strong partnerships with our community businesses who provide employment opportunities to these clients. Our partner businesses engage in specialized training to learn best practices in supporting employees with developmental disabilities. The PIPE program uses a person-centered rapid job search philosophy that includes assessment, placement with a job coach, and several days of follow-along assistance. In fiscal year 20, Northeast Delta supported 5 in-person PIPE support agency meetings and delivered virtual training and education to 10 new community agencies. 19 new incoming client referrals were enrolled in the PIPE program during fiscal year 20. Northeast Delta manages numerous programs and services for clients with developmental disabilities. Next, we'll take a quick look at some of these efforts in fiscal year 20. During fiscal year 20, the Northeast Delta Developmental Disabilities Department served over 2,000 individuals. As the single point of entry for the Northeast Delta service area, the DD department provided 576 individuals with developmental disabilities over $870,000 in stipends, services, supplies, and home and vehicle modifications that allowed those individuals to remain living in their homes and their communities. The DD Medicaid Waiver Program Unit provided programmatic oversight, including certification and accountability, over 1,300 Medicaid waiver participants. Over 900 new DD applications were received during fiscal year 20. 469 eligibility determinations were made, and 525 clients with developmental disabilities were served with state funds. The 469 eligibility determinations that were made accounted for 97% of reviews, where only 3% were determined ineligible. In addition to the clinical services and developmental disability services provided by Northeast Delta, the agency also maintains a highly productive prevention and wellness department. The prevention and wellness team organize and implement several community-based programs and activities each year. These activities are designed for both professionals and for the public to increase awareness of behavioral, mental, and primary health risks and strategies to improve health and wellness. Part of the Prevention and Wellness Department's ongoing program is participation in the performance of SINAR checks. The SINAR program, which is overseen by the Substance Abuse and Mental Health Services Administration, requires states to establish and enforce laws to prohibit the distribution and sale of tobacco products to minors. Regular SINAR checks are performed to ensure compliance with these laws in every state. Northeast Delta completed 394 SINAR checks in fiscal year 20 with an 88% compliance rate. SINAR checks are completed in each of the 12 parishes in Region 8 served by Northeast Delta. Over 38% of the fiscal year 20 SINAR checks were completed in Ouachita Parish. Right around 93% of our SINAR checks completed in fiscal year 20 were performed at convenience stores selling gas. Other retailers that are checked for compliance included convenience stores without gas, franchise discount stores, and one each of a chain drugstore pharmacy and a tobacco discount store. Tobacco types attempted to be purchased during the CINAR check included smokeless tobacco, cigarettes, cigar packs, and cigars. Cigarettes accounted for about 94% of CINAR checked tobacco types in fiscal year 20. Northeast Delta's Prevention and Wellness Department actively engages in continuous efforts to address the opioid addiction epidemic in our state and specifically in our region. One of the ongoing initiatives supported through the LaSOR grant is Narcan training and kit distribution. Narcan is an opioid overdose reversal agent and prescription aid that can be used in an opioid overdose emergency. The Prevention and Wellness team provides both training to community agencies and members, as well as Narcan kit distribution, providing these Narcan kits to groups such as emergency medical response teams. In fiscal year 20, Northeast Delta hosted 28 Narcan training and kit distribution events. The events were held across 3 different parishes in the service area, and 190 kits were distributed during the event. Northeast Delta's Narcan training is free, and it provides information to attendees to help them learn how to determine if a person may be overdosing from opioid use and how to respond to an opioid overdose, learn how to properly administer Narcan, and learn about ways to reduce opioid overdose deaths and ways individuals can help stay safe. The Prevention and Wellness Department at Northeast Delta is also actively engaged in school-based programs designed to educate children and youth on the dangers of substance use and abuse, as well as gambling and other unhealthy behaviors. Through delivery of these programs, over 8,800 students from preschool to high school received this education in fiscal year 20. This includes specific opioid education too, which was delivered to over 1,500 students in 3rd to 11th grade. In-school programs overseen by Northeast Delta's Prevention and Wellness Department include evidence-based programs designed to teach children and youth life skills and behavioral management to stay strong and positive in uncomfortable situations involving peer pressure and unwanted persuasion. This next graph shows the distribution of program delivery across grade level and type of program. The information demonstrates the careful thought involved in providing education to students from preschool to high school in order to deliver the most effective programs at the most critical times. Over 27% of the more than 8,000 students who received in-school prevention and wellness evidence-based education in fiscal year 20 were middle school age children receiving life skills training. And as you can see, gambling education is presented to children as young as elementary school age. In order to successfully deliver such effective prevention and wellness programs, Northeast Delta partners with community agencies and groups to develop strong working relationships. Among these partnerships include the Children's Coalition of Northeast Louisiana, Louisiana Tech University, the Louisiana Center Against Poverty, and West Carroll Safe and Drug-Free Volunteers. As the numbers show here, each partnership is crucial to the delivery of Northeast Delta's prevention and wellness initiatives in our parish schools. OWLS PALS is a nationally recognized evidence-based curriculum and teacher training program that develops social, emotional, and life skills in children aged 3 to 8 years old. Our partnership with the Children's Coalition of Northeast Louisiana allowed delivery of this program to nearly 1,700 children in our region. Some of our partner agencies, such as the Louisiana Center Against Poverty, work with our prevention and wellness team to deliver multiple programs within our regional schools. Through this partnership, nearly 3,500 school-age children received important evidence-based life skills training and education focused on the problems surrounding youth gambling. As I discussed earlier in the webinar, Northeast Delta serves the citizens of Region 8 in Northeast Louisiana using a holistic approach to service delivery. Our services and programs go beyond traditional behavioral and mental health treatment. We recognize that social determinants of health are vital to not only seeking and obtaining treatment, but in successfully maintaining optimal health and quality of life. This philosophy is truly the foundation of our unique integrated healthcare model. A piece of our overall integrated healthcare model includes our involvement in the federally funded PIPBHC grant. In the fall of 2018, Northeast Delta was selected as one of 4 statewide grantees by the Louisiana Department of Health, Office of Behavioral Health, to be awarded the SAMHSA grant called Promoting Integration of Primary and Behavioral Health Care, PIPBHC, as we call it here. Since that time, we have continued to expand integrated behavioral and primary health care efforts, not only in terms of the PIPBHC grant, but across our clinics and service offerings. In fiscal year 20, PIPBHC grant programmatic services were expanded beyond our Bastrop Mental Health Clinic, which was the pilot clinic for PIPBHC grant activities, to now include clients seen for mental health and/or addiction disorders at our Monroe Behavioral Health Clinic as well. Following initial screening and assessment of 172 potential new enrollees, an additional 152 clients were enrolled into the PIPBHC grant in fiscal year 20, increasing our total enrollment to 223 by the end of the fiscal year. Also, during fiscal year 20, 6-month reassessments were completed on 159 clients, and 12 of our clients completed a 12-month reassessment. PIPBHC-related client assessments include a standardized national outcomes measurement, primary health assessments such as vitals like blood pressure and weight and waist circumference, assessment of CO levels in both smokers and non-smokers, depression, anxiety, and PTSD assessment scales, and monitoring labs for glucose and cholesterol levels. In the future, Northeast Delta will expand primary health services like these to all 6 outpatient clinics so that we can provide all of our clients the opportunity to benefit from a non-traditional medical home while seeking behavioral and mental health services. So what you've heard up to this point is an overall summary and fiscal year 20 data for Northeast Delta's ongoing daily programs and services. But there's so much more to what our agency offers Northeast Louisiana from year to year. Now we'll take a quick look at some of the agency's additional special initiatives from fiscal year 20. As you can see by skimming this list, Northeast Delta offers many things to many different people. Our agency truly offers something for everyone. A few new initiatives added in fiscal year 20 include the Transformations blog and the COVID-19 information portal, both of which can be found on our website. The Transformations blog is written by our Executive Director, Dr. Sizer, and offers messages of hope and inspiration crucial to ongoing optimism in the times we have been recently facing. Information concerning national and state COVID-19 data, as well as agency-specific and clinic information pertaining to COVID-19, can be found in the COVID-19 informational portal on our website. Our website is available to the public, so you don't have to be a client of Northeast Delta to access any of the information on our site. But of course, we welcome you to become a client. Now I'm going to briefly discuss a few of our other fiscal year 20 initiatives. Northeast Delta's Prevention and Wellness Department hosted its 2nd opioid summit called Reducing the Pain. The purpose of the conference was to inform the people in our region about prescription drug and opioid misuse and abuse, and how the national and state crisis affects millions of people across America and thousands of people in Louisiana every day. With over 250 individuals in attendance, it offered an opportunity for behavioral health professionals, healthcare workers, law enforcement, federal, state, and local officials, clergy, and advocates to come together and collaborate on how to meet this complex societal issue with action. The summit included 4 breakout sessions that were focused on 2 different tracks, a clinical track and a community track. Our Agents Opioid Prevention Program, which is funded by the Louisiana State Opioid Response Grant, provided 100 bags to Madison Parish Hospital and rural health clinics. The bags contained Deterra, which is a prescription drug disposal bag for unused meds, agency-related informational brochures, opioid-related statistics, and Narcan. Also in fiscal year 20, Northeast Delta hosted Signs of Suicide training, a curriculum of the nonprofit initiative Signs of Suicide, which provides suicide prevention, education, and screening throughout the country. Nearly 60 mental health professionals, counselors, and school staff from our region received training on how to safely address and prevent bullying and self-injury at this training. Our agency also continued its faith partnership clergy training, which is aimed at helping faith communities address addiction in their congregation and membership. The fiscal year 20 event was a 2-day training that focused on equipping clergy with knowledge and skills to initiate and support prevention and addiction recovery ministry efforts in faith congregations and communities. Also, in supporting our faith partnership initiative, focus group meetings were held quarterly to engage, problem solve, and encourage faith leaders during the development of their congregation's efforts to address alcohol, drug, and addiction issues. In conjunction with our ongoing faith leadership initiative, Northeast Delta partnered with New Living Word Ministries in Lincoln Parish for the Ruston Listening Session in fiscal year 20. During this session, community and faith leaders met to discuss their concerns of local social issues and to gain insight on concrete, actionable steps to address the issues in their community. Northeast Delta also attended a community prayer rally in Washita Parish, where they joined local pastors and law enforcement officers and community members in raising mental health awareness and speaking to attendees about the stigma that exists around mental illness and the need to address mental health issues in families and communities. Also in fiscal year 20, Northeast Delta launched a new initiative providing agency clients living in Lincoln Parish the opportunity to pursue expungement with the aid of a professional attorney. Agency clients who are currently receiving services or had already completed the screening process to be seen and had a criminal conviction or arrest for a misdemeanor or a felony in Lincoln Parish were eligible to participate in this initiative. This program was designed to provide an additional way for the agency to reach the clients who are actively seeking treatment and recovery and offer them a second chance to be reintegrated back into society. Participants were provided with information about the agency services, including behavioral and primary health care clinics and our screening services, transitional housing information, workforce training, and support services we offer. The expungement event was a key component of the agency's overarching workforce initiative, which is designed to help citizens gain self-sufficiency by providing them with the tools and skills necessary to re-enter the workforce and become a contributing member of their communities. Finally, 2 important studies were conducted during fiscal year 20. First, the economic impact of Northeast Delta Human Services Authority was completed by economic professors at the University of Louisiana, Monroe. Estimated impact was assessed based on household income and regional value added. This study estimated the single-year economic impact of the agency as over $21 million and a 10-year present value impact of nearly $192 million. While there are indirect and ripple effects that can't be quantitatively measured, these impact estimates alone demonstrate that the value of Northeast Delta's program and services and the mere existence in our region has a substantial impact on Northeast Louisiana's economic climate. The second study, conducted in fiscal year 20, was the Northeast Delta COVID-19 Social Health Impact Assessment. In March of 2020, the agency developed the COVID-19 Social Health Impact Assessment designed to collect data related to the COVID-19 pandemic and its effects on the social health of our agency clients, as well as other citizens residing in our 12 parish service area and even beyond. Areas of assessment included demographics, personal relationships and living situations, employment, resource concerns, including household finances, food security, healthcare, and social relationships, personal well-being, mental and behavioral health status, and also general media access and pandemic practices were all assessed. A total of 467 agency clients completed this assessment, and 139 individuals from the region, state, and beyond completed the assessment, which was available online to the public. Agency clients were contacted by agency clinical staff to complete the assessment and to discuss their feelings and concerns about the pandemic. This full report, as well as the recorded results webinar that was presented back in August of 2020, can be found on our website for review. That's the overview of Northeast Delta's fiscal year data review. To learn more about Northeast Delta and the services and programs offered, please visit our website. I appreciate everyone who joined in today, and I hope that you'll join us again for future webinars from the Northeast Delta Analytics Department. Thank you, and I hope everyone has a wonderful holiday season.
Thank you, Dr. McGee, and thank you all for joining today. Please visit our website at www.nedeltahsa.org. Again, www.nedeltahsa.org. And follow us on our various social media handles at NEDeltaHSA. Northeast Delta Human Services Authority, building a unified Northeast Louisiana where individuals are thriving and reaching their full human potential.